Hello. Hi there. How are you? I hope that you all are in very good health. I'm Dr. Shariful Halim, and I'm here to give you some health tips, especially the tips regarding your diet. So that most of the people in our country takes 3 meals a day: a breakfast, a lunch, and a good dinner. Okay. So the orientation of those meals will be that the breakfast should be the best meal of the day uh, because the breakfast should drive the energy that you need to have to do the things that you do in the day. So in the daytime people are most active, so the breakfast should be the best meal, and in the lunchtime they should have a reasonably good meal, and in the dinner they shouldn't have a lot of things to eat. They should eat as less or as little as possible, because that in the night the peoples don't actually work that much, and the body, rather utilizing the food, the body tries to store the food and actually makes the people to gain weight. So if you don't want to gain weight, please don't eat at night. Don't eat, actually I shouldn't say that. Please don't eat much at night, and if you can, after taking the dinner, you should walk a few minutes. Okay, that will help you to metabolize some of the foods that you have took the dinner and to lose some weight. Okay, so let's talk about the contents of the food that you should have. So in the morning, that most of the people in our country takes parathas with or without oil, and also some people takes breads, and along with parathas or breads, some people takes jelly, some people takes pulses like or dal in the local language, and also the people takes eggs or vegetables. So in consideration to some patients, especially diabetic patient, they shouldn't have breads first of all, and more, they shouldn't have breads with jellies, because those two are very grave agents, especially jellies, because jellies are sweet. Jellies have very bad sweeteners which will rapidly increase the blood sugar level and cause a havoc to the glycemic control of a diabetic patient. So they should always avoid jellies and also avoid breads. What they can take is they can take the parathas without the well, that is good for the glycemic control. And for the people who wants to gain weight, they should take egg, especially egg whites. That's very good, because the egg whites contain albumin, which is a very good protein, and it will help to build the muscles in the body. And about the egg yolk, the patients who have coronary artery disease or cerebrovascular disease or something like that, they shouldn't have egg yolk. They can only eat the egg white. Okay, and vegetables, you should have as much vegetables as you can, especially the green leafy vegetables, to have the supply of folic acid, which will help to have very good fresh bloods to production of RBC or red blood cells. So it's very good for your blood. And also about other vegetables, like the vegetables which are colored, like papaya or maybe carrot or something like that. Those are very rich in vitamin A. So especially girls who want to have some good skin, they should eat this kind of vegetables. They will help to have a very fresh skin, and a fresh skin is a beautiful skin. And also the vitamin A also helps in vision. So who wants to have a very good vision, they should eat colored vegetables. Okay, so next let's talk about the lunch. In the lunch, most of the people take rice along with curry, and the diabetic patient can take one rice meal a day, but other people can take two rice meals. But in case of diabetic, the rice meals shouldn't be more than one, because rice is associated with a poor glycemic control. And along with rice, we take many curries, and among them, the best thing to take is fish. And among fishes, small fishes are best, because small fish is a very high content of protein, high content of calcium, which will help you to build your bones, so to strengthen them and prevent fractures in the later life. And also you have to consider about the vitamins A content, especially the small fishes have a very good amount of vitamin A. Next is the curries, the beef, chicken, and mutton. So in case of diabetic patients and patients with a history of atherosclerotic diseases like ischemic heart disease or cerebrovascular disease, they should avoid red meat, especially beef. And mutton is okay, but the best thing to take is chicken, especially the deshi chickens. Okay, the next is night snacks. So as I have already mentioned, that the night meal should be limited. You shouldn't eat much at night, and you should preferably eat more vegetables at night, because it will give you the satiety, and it will drive the food contents out of your intestines rapidly, and also you will take less sugar containing food and more vegetable containing food, which will prevent the rise of blood sugar in your blood. Okay, so it's very important or very good in case of diabetics. And also one major thing is water, especially in countries like us. We have a very hot and humid environment, so we lose a lot of water, and most of the time people are dehydrated. That's why, so always keep a bottle of water with you and drink as much as you can. So the standard drinking regime should be at least 8 to 10 glasses a day, but in a hot environment 8 to 10 glasses a day are not enough. So drink as much as you can, because the water is a main environment inside your body. If you are a person of 60 kg, you're about 60% or to 70% of your body weight is made up of water. So some person with 70 kg adult may have 42 liters of water, 42 kgs of water. So it's a very big bulk of your body. So it's the environment, so you need to refresh the environment regularly. So drink water, and also the toxic substances that build up in body will be excreted easily if you drink a lot of water, and your kidneys will be in good health. So take water as much as you can. Okay, so those are the dietary advice from me, and I hope that those advice will benefit you. And also, if you have any queries, you can ask me in the comment section. And also, don't forget to like and subscribe to my channel. Thanks for watching the video.